Remove your socks immediately from both of your feet, place them flat against the ground, and inspect them under a bright light before you do anything else this evening. The majority of individuals glance at their feet and notice only dry skin, perhaps a minor callus, or a toenail requiring a trim, viewing these as purely cosmetic issues to address at a later time. What I observe when examining feet, particularly those of individuals past the age of 60, is an active status report originating from the deepest levels of your nervous system, a biological readout that has resided at the bottom of your limbs your whole life, silently transmitting data that almost no one has shown you how to decipher. The factor that makes this situation so critical is diabetic peripheral neuropathy, a form of nerve degradation triggered by chronically high blood glucose that impacts approximately half of all individuals living with diabetes. Even more startling is the reality that nearly 50% of those currently living with type 2 diabetes remain completely undiagnosed, meaning millions of Americans are experiencing active nerve damage right now from blood sugar elevations they have never screened or were told were merely borderline before being dismissed with generic advice to limit their carbohydrate intake. This neurological degradation does not delay its onset for an official medical diagnosis, as it begins prematurely, advances silently, and drastically reduces the opportunity for straightforward recovery by the time noticeable sensations finally emerge. However, the lower extremities hold the clues, preserving physical evidence of this decline long before any overt symptom becomes impossible to ignore. Over the course of the next 20 minutes or so, you will discover precisely how to identify these early warning signs. Prior to analyzing the 6 clinical indicators, I want to dismantle a widespread misconception that actively compromises patient health outcomes every single day. This misconception is the belief that sensations of tingling, numbness, or burning in the lower extremities are simply signs of inadequate blood flow. That is the primary assumption made by most individuals, and it is unfortunately the default conclusion reached by many non-specialist healthcare providers as well. Patients are frequently told that their circulation is merely sluggish and that they simply need to walk more often. In reality, vascular circulation and neurological function operate on entirely different systems, and though they are interconnected and can degrade simultaneously, they fail through distinct physiological pathways, present unique symptomatic profiles, and demand completely separate therapeutic approaches. Addressing nerve degradation as if it were a vascular circulation issue is comparable to rewiring your home because your faucets have low water pressure. While both infrastructure networks exist within the same structural walls, they do not utilize the same pathways. Peer-reviewed literature published in Diabetes Care has firmly established that peripheral neuropathy and peripheral arterial disease are distinct clinical pathologies with unique diagnostic parameters, even when they present concurrently in the same individual. Distinguishing between these two conditions is not a minor clinical nuance, but rather the central factor in determining proper treatment. In order to comprehend what you are searching for this evening, you must first grasp the biological processes occurring beneath the surface of your skin. Your feet represent the most distant anatomical region from your central nervous system. They also endure the highest degree of physical and mechanical strain of any structure in your body. With the typical individual logging between 6,000 and 10,000 steps daily, the underlying tissues must absorb and distribute far more repetitive impact than almost any other anatomical system. Woven throughout every square inch of this tissue is an intricate network of peripheral nerves, which are elongated, slender fibers responsible for transmitting 2 primary categories of data. Sensory pathways carry information upward toward the brain, communicating variables like pressure, temperature, pain, vibration, and the literal texture of the surface you stand on. Motor pathways transmit instructions downward from the brain to coordinate the microscopic muscles of the foot, ensuring correct toe alignment, supporting the arch, and stabilizing your walking stride. A third group, known as autonomic nerve fibers, regulates the local sweat glands and microvasculature responsible for managing skin hydration and surface temperature. Each of these 3 distinct nerve pathways is highly susceptible to the damaging effects of chronic hyperglycemia. The underlying biological mechanism involves excess systemic glucose binding directly to cellular proteins in a chemical process known as glycation. This process effectively degrades the essential proteins that comprise the myelin sheath, which serves as the protective insulation surrounding every individual nerve fiber. This protective coating is what enables bioelectrical impulses to travel rapidly and without distortion between your lower extremities and your brain. As this insulation breaks down, the transmitted signals slow, warp, weaken, and ultimately cease entirely. Imagine the protective rubber lining of an electrical wire slowly eroding from within. Though the metal conductor remains intact, the electrical current can no longer flow through it without disruption. Initially, this produces minor feedback, but it eventually leads to complete communication failure. This breakdown creates a unique danger that is virtually unmatched by other health conditions. When sensory pathways cease to function, you lose the vital capacity to perceive physical trauma. You will not notice a friction blister developing inside your footwear, the extreme heat of bath water you step into, or a sharp pebble grinding into the ball of your foot. Microtrauma occurs, skin and tissue degrade, and you continue to bear weight on the injury for days or even weeks because your biological warning system has effectively lost its power source. This is the precise pathway through which a minor abrasion escalates into a profound tissue infection. This progressive infection rapidly transforms a localized issue into a severe surgical emergency. This failure of sensation drives the more than 100,000 lower limb amputations executed annually across the United States, the overwhelming majority of which stem not from sudden trauma, but from simple wounds that went unperceived, ignored, and untreated during the critical window. The initial clinical indicator is one you can easily evaluate this evening using only a standard wooden toothpick and 90 seconds of focused observation. Find a comfortable place to sit, hold one foot with both of your hands, and either shut your eyes or enlist a partner to assist you. Keeping your eyes closed, utilize the rounded, blunt end of the toothpick rather than its sharp point to gently apply pressure to the pad of each toe, the metatarsal ball, the instep arch, and the heel. At each location, consider whether you can detect the contact and accurately identify the exact spot being touched. Fully functional peripheral nerves in the lower extremity should easily perceive subtle pressure with high spatial accuracy. If you identify regions where feeling is diminished, absent, or where you cannot pinpoint the contact without looking, that sensory discrepancy is a clinically meaningful finding. Scientific data reveals that a decline in plantar pressure sensitivity on the sole is one of the earliest measurable indicators of neuropathy, frequently manifesting years before any painful sensations or obvious symptoms develop. The second clinical sign involves the skin itself, which happens to be among the most routinely overlooked or misinterpreted physical findings in clinical practice. Inspect the skin of your lower legs and feet, looking closely to see if it is exceptionally dry, not from cold weather or harsh soaps, but exhibiting a chronic dryness that fails to improve with any topical cream. Does the skin present a thin, glossy appearance in certain spots, as if the surface has been pulled taut or polished smooth? The autonomic nerve pathways responsible for regulating sweat gland activity are frequently among the earliest victims of glucose-induced nerve damage. When these fibers cease to function, the sweat glands lose their neural input, the skin stops manufacturing its natural lipids and moisture, and the tissue becomes brittle, leading to severe cracking along the heels and metatarsal pads. These microfissures in compromised skin lacking proper autonomic maintenance act as open pathways for pathogens in individuals with high blood sugar, whose immune defenses are already weakened, initiating a cascade of complications that frequently culminates in surgical intervention. Gently slide your palm across the skin of your calves and the upper surface of your feet. A normal, healthy foot should possess a distinct, slightly textured surface. In contrast, skin experiencing autonomic nerve loss feels notably thin, papery in certain areas, unnaturally smooth, and cracked where it ought to remain soft and flexible. The third indicator is a thermal imbalance, which you can easily evaluate right now without any diagnostic equipment. Press the back of your hand, which is highly sensitive to temperature variations, against your left foot and then your right foot. Maintain contact on each foot for 10 full seconds. Under normal conditions, both feet should exhibit roughly the same level of warmth. While minor fluctuations are expected, a pronounced and repeatable temperature discrepancy between your limbs is not merely a consequence of your posture. Instead, it points to uneven vascular circulation and, more precisely, asymmetric autonomic nerve signaling managing the microvessels within each foot. A foot that remains constantly colder than its counterpart typically suggests that the local autonomic nerve supply on that side has suffered greater degradation. Conversely, a foot that is persistently warmer, especially when accompanied by mild redness, may signal an active inflammatory response in the deeper tissues, which can be a precursor to a severe condition known as Charcot arthropathy that we will examine shortly. The fourth indicator is a structural change that most seniors mistakenly attribute solely to the aging process, family history, or poorly fitting shoes. Take a close look at your toes to determine if any of them are starting to bend inward. Observe whether the second or third digit has developed an involuntary fixed bend at the central joint, a deformity medically referred to as a hammer toe. Check if your smallest toe is beginning to tuck underneath the adjacent digit. Assess whether your arch has altered its shape, either collapsing flatter against the floor or arching higher than before. The delicate internal muscles of the foot responsible for aligning the toes, supporting the arch, and distributing weight across the skeletal frame are driven by motor nerves originating in the lower back. When high blood glucose compromises these fibers, these tiny muscles begin to weaken and waste away. Lacking opposition, the stronger muscles of the lower leg pull unevenly, gradually causing structural deformities in the foot. This structural shift is far more than an aesthetic concern. A hammer toe developing on a desensitized foot creates a hard, bony protrusion that continually rubs against the interior of your shoe, generating an abrasion that remains entirely unnoticed until a deep tissue infection is fully established. A fallen arch disrupts your walking mechanics, alters weight distribution, and forces abnormal pressure onto delicate skin areas that were never structurally designed to tolerate such stress. If you have noticed structural shifts in your feet over the past few years, you should schedule a consultation with a podiatrist rather than simply ordering over-the-counter insoles online. The fifth indicator is a critical assessment that belongs in every routine physical exam, yet is routinely omitted. Take note of whether you still have hair growth on your lower legs and toes. While this might seem insignificant, it is actually a highly reliable clinical indicator. The hair follicles on your extremities rely heavily on robust microcirculation and intact autonomic nerve stimulation to survive. As vascular issues or autonomic neuropathy begin to restrict these systems, one of the first noticeable signs is a cessation of hair growth below the knee. This manifests as smooth, hairless skin on the shins and toes where hair used to grow normally. Studies in the Journal of Vascular Surgery identify this loss of hair, alongside thin, glossy skin and delayed capillary return, as a classic clinical triad indicating early peripheral arterial disease, a condition that regularly coexists with diabetic neuropathy. Examine your lower legs right now, and then inspect your toes. If you notice a substantial reduction or complete absence of hair compared to last year, compared to the opposite limb, or compared to your memory, document it with a photo and share it with your primary care provider. The sixth sign is the most alarming, and if you observe it, you must bypass educational videos and seek immediate specialist care today rather than waiting for your next monthly checkup. This condition is known as Charcot neuroarthropathy, or Charcot foot, and its onset is particularly dangerous precisely because it is painless. It presents as a single foot becoming warm, highly inflamed, and noticeably severely swollen. The swelling and heat develop rapidly, appearing over a matter of days rather than weeks. Because the local pain receptors are already severely compromised, the patient feels little to no discomfort. Due to this lack of warning pain, individuals continue to walk and bear weight normally on the limb. They remain active on a foot that is undergoing active bone fractures and joint collapse. This weight-bearing continues until the entire structural framework of the foot is permanently compromised. When identified early, Charcot foot can be successfully managed through total immobilization and specialist intervention. Left unchecked, the late stages result in profound deformities that permanently impair mobility and elevate the risk of deep infection. The absolute key to avoiding this outcome is identifying a warm, swollen, and painless foot at the very onset. Let me clarify the immediate warning signs that require you to contact a healthcare provider immediately rather than waiting for a scheduled visit. If you discover any blister, abrasion, crack, or sore on your foot that persists past 1 week without clear signs of healing, you must treat this as an active medical concern. If you present with a single foot that is noticeably hotter, redder, and more swollen than the other, particularly with a history of glycemic issues, you need professional evaluation immediately. If you experience complete sensory loss on the bottom of your foot, where applying firm pressure yields absolutely no sensation, this represents a serious clinical situation. If you spot any open sore exhibiting dark, necrotic, or foul-smelling tissue, you are facing a medical emergency. This is not a situation to monitor at home, but one that requires a same-day medical consultation. These guidelines are not exaggerated for dramatic effect, but are the actual clinical boundaries that determine whether nerve and tissue damage can be reversed. Commit these clinical thresholds to memory today. Here are 2 simple screening tests you can perform at home tonight that require less than 3 minutes in total. The first assessment is the capillary refill test. Apply steady pressure to the nail of your great toe until the tissue underneath blanches pale. Let go of the pressure and note how quickly the natural pink hue returns, which should occur within 2 seconds. A delay longer than 2 seconds indicates that the microcirculation to that toe has been compromised. While this is not an official diagnosis, it is a clear indicator that your peripheral blood flow should be professionally examined. Perform this test on both feet to compare the circulation on each side. The second assessment is the vibration sensitivity test. If you own a metal tuning fork, tap it against a hard surface and place the vibrating stem directly against the tip of your big toe. Notice whether you can distinctly perceive the physical vibration. Under normal circumstances, most individuals can detect this sensation very clearly. If the sensation is absent or notably weaker than what you feel when touching the active fork to your fingers, this discrepancy points to a loss of vibratory perception in your lower limbs. The ability to feel vibration is typically one of the earliest sensory modalities compromised by diabetic neuropathy. Official guidelines from the American Diabetes Association highlight the importance of annual vibratory screenings for all diabetic patients, although clinical data reveals that healthcare providers rarely perform these exams as regularly as recommended. If you lack a tuning fork, simply utilize the toothpick method from the first sign and compare the sensation in your feet directly to the sensation in your fingertips under the same light pressure. Establish a structured routine of dedicating just 5 minutes once a week at a consistent day and time to this screening. Approach this as an ongoing health log designed to track subtle physical developments over time rather than a single, isolated checkup. Begin with bright, natural lighting whenever possible, positioning the foot to thoroughly inspect the top, sole, heel, and the spaces between each toe. Keep in mind that the dark crevices between your toes are precisely where undetected lesions frequently begin. Next, check for a healthy, even pink color across both of your feet. Any localized persistent redness typically indicates an active pressure point or an early infectious process. A pale or bluish discoloration usually signals a restriction in arterial blood flow. If one foot appears noticeably darker or more flushed than the other, you should consult a podiatric specialist immediately. Third, assess skin temperature by pressing the back of your hand against each foot for 10 seconds, checking that both sides feel equally warm. Any consistent, uneven thermal difference between your limbs warrants further medical evaluation. Fourth, evaluate skin texture by gently sliding your palm over the entire surface of both feet. A smooth, hydrated, and flexible surface indicates healthy tissue. Skin that is dry, cracked, glossy, or unusually thin suggests compromised autonomic nerve function. Fissures between the digits serve as open entry points for opportunistic bacterial infections. Apply a simple fragrance-free lotion nightly to dry areas, being careful never to put it between your toes. Retained moisture in the dark spaces between your digits creates an ideal environment for fungal growth. Fifth, examine the structural alignment of your toes from both the front and side angles. Document any new structural shifts, overlapping digits, or curling that has developed since your previous weekly check. Sixth, execute the toothpick sensory test across 4 key areas on each foot, including the big toe, the metatarsal pad, the arch, and the heel, while keeping your eyes closed, noting precisely where you can or cannot feel the touch. Take a digital photograph of both feet from an identical angle and distance once every week. After 3 months, you will have compiled a comprehensive visual record. Microscopic changes that remain imperceptible from week to week become highly obvious when compared across a 12-week period. This visual log serves as invaluable objective data that you can present to your healthcare provider. It provides concrete physical evidence, saving you from relying on memory to recall the exact progression of a past sore. If you have ever received news that your blood sugar is slightly high, pre-diabetic, or simply something to monitor, Do not wait for an official diagnosis before taking steps to protect your lower limbs. Neurological degradation frequently begins well within the pre-diabetic glycemic range. Clinical evidence has clearly demonstrated that measurable peripheral neuropathy often develops long before a patient crosses the official laboratory threshold for type 2 diabetes. The most crucial diagnostic marker you should request alongside your standard fasting glucose test is your fasting insulin level. Fasting insulin levels reveal precisely how much effort your pancreas must exert to maintain your blood sugar within normal limits. A pancreas that is working several times harder than normal to maintain standard glucose levels is indicating a physiological strain that a standard glucose test completely obscures. Make a point to request this specific test during your next clinical blood draw, as standard metabolic panels rarely include it by default. Additionally, ask your physician to run an A1C test to evaluate your average blood sugar levels over the past 3 months, rather than relying solely on a single day's reading. Here are practical steps you can implement starting this evening to actively protect your peripheral nerve health and slow the progression of physical damage. Every morning before standing, spend 60 seconds performing ankle rotations, doing 10 clockwise and 10 counterclockwise circles on each side. Next, stand up and perform 10 calf raises, holding the peak position for 2 seconds before lowering your heels slowly back to the floor. This movement engages your calf muscle pump, a mechanism that helps return venous blood from your lower extremities back up to your heart before gravity has spent the day pulling fluid downward. During the day, avoid sitting continuously for more than 45 minutes without standing up to take at least 20 steps. Consider setting an alarm on your phone to remind you to move. The pooling of venous blood that occurs during long periods of inactivity is not merely a vascular concern, but also creates an oxygen-deprived cellular environment that accelerates local nerve damage. Your evening routine is the most critical part of this entire protocol. Cleanse your feet using lukewarm water rather than hot water. Because you may not accurately perceive temperature, always test the water with your elbow instead of your foot to avoid accidental burns. Once washed, pat the skin completely dry, paying careful attention to the delicate spaces between each toe. Apply a fragrance-free moisturizing lotion to the soles, heels, and tops of your feet, making sure to avoid the areas between your toes. Afterward, prop your feet up on a comfortable pillow and spend 3 minutes conducting the toothpick test and the structural visual check outlined previously. If you have already been diagnosed with reduced sensation, make sure you never go to bed without thoroughly inspecting the soles of both feet. Placing a small hand mirror on the floor is an easy way to view the bottom of your feet without straining your back. Your primary goal is to spot any new marks, redness, or lesions that were not present earlier in the day. Consider this vital physiological reality as you reflect on your health tonight. The bodily changes that cause peripheral neuropathy to progress more aggressively, including a slower rate of nerve regeneration, delayed immune responses, and reduced growth hormones for tissue repair, all accelerate significantly after age 60. Once you pass 70, this biological acceleration increases even further. Consequently, the window of time between a minor abrasion and a severe medical outcome shrinks with every passing decade. This is not intended to cause alarm, but rather to help you understand why a weekly 5-minute foot check is absolutely essential as we age. It represents fundamental physical care for the structures that keep you upright and mobile throughout your life. How old are you currently? Please share your age in the comments section and let me know where you are tuning in from this evening. I make sure to read every single comment posted here. Understanding the demographics and locations of our community directly guides the topics I address in upcoming videos. Every interaction helps expand our reach to individuals who desperately need these health insights but have not yet discovered them. If this message was helpful to you, please share it with others who might benefit. Prioritize your health by inspecting your feet tonight rather than waiting until tomorrow.